Hi, good evening. My name is Courtney Hederman, and I'm the Associate State Director for AARP Illinois, along with our State Director, Bob Gallo. We want to welcome you to this important discussion about coronavirus. Tonight we are on the line with Illinois Congressman Sean Casten and Rush Copley physician Dr. Kate Rowland. We will discuss how you can stay informed and stay healthy. We will also be addressing your questions on this call. I encourage you to have a pen and paper ready to write down important phone and website resources so you can access and get continuous updated information about coronavirus. If you would like to ask a question about coronavirus on this call, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. Again, to ask a question, please press *3. In the face of the coronavirus pandemic crisis, AARP, a nonprofit, nonpartisan organization, is providing information and resources to help older adults and those caring for them to help protect themselves from the virus and prevent its spread to others. If you would like to stay on top of the most recent and up-to-date information after this call, you can visit AARP's website at www.aarp.org/coronavirus. Or to find the latest information for Illinois, please visit www.coronavirus.illinois.gov. You can also call the Illinois Department of Public Health at 1-800-889-3931 or the Illinois Department on Aging Senior Helpline at 1-866-252-8966 with any questions you have regarding senior services for you or your loved one. So right now is your opportunity to learn, ask questions, get answers from Congressman Casten and or Dr. Kate Rowland on what to do to stay safe and where you can get additional resources. So if you participated in one of our teletown halls before, you know this is similar to a talk radio show, and you have the opportunity to ask questions live. So again, if you would like to ask a question about coronavirus, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. So again, to ask your question, please press *3. So we are very fortunate and very, very excited to welcome this evening. We have with us Illinois Congressman Sean Casten from the 6th District. Thank you, Congressman Casten, for taking time out of what I know is a very hectic schedule these days to speak with our members. So good evening to you.
Thank you, Courtney. Pleasure to be here, and thank you all for taking the time to set this up. Look forward to getting to questions, but want to just give a couple quick overviews for folks about what we've done legislatively and what we're trying to do, because we will continue to. We're by no means are we complete yet. The most important thing I want to stress for everybody is that this is a public health crisis and an economic crisis. We cannot separate one from the other. If we open the economy too quickly, we're going to create massive more public health and therefore more economic crises. On the other hand, if we wait too long, there are, of course, all sorts of challenges that happen when people can't get paid and mental health issues and failure to get health. And so we're doing everything we can to solve both of those simultaneously, but they are intimately connected. We have passed 3 bills related to the coronavirus crisis. The first was a $8.3 billion bill. It also included $7 billion for additional small business lending. That was primarily focused on getting money to public health communities, or public health resources, research for vaccines, research for treatments. The second bill was the $100 billion with a B dollar Families First Act, and that was around extending unemployment insurance, making sure that businesses were reimbursed for the costs associated with people having to take more sick leave. And then, of course, the $2.2 trillion CARES Act, which has a large number of bills, including expansions of the programs that I talked about, additional food aid, and, of course, the payments to every American. There will be more bills that we're going to do, but I want to just flag a few things that are particularly relevant to seniors in those bills. Number one, these stimulus checks, which are $1,200 per person provided your income is up to $75,000, and then it is pro rata reduced as your income is above that level. Those will go out to Social Security recipients. If you've got a 1099, you will receive those checks. You will receive those either this week via direct deposit if that information is on hand, or then will start being paid out thereafter in the mail. And you can get on that direct deposit list through the Treasury Department websites. We have also waived the required minimum distribution rules for 401ks and IRAs in 2020. As I'm sure I don't need to tell you all, that's particularly relevant since the required distribution indexes to the year end from 2019, and given what's happened in the stock market, that could be very painful for folks. So we've waived that. For those of you who are paying off student loans, we have waived the obligation to make federally held student loan payments for 6 months until September 30th, and interest will not accumulate during that period. We've provided an additional $730 million with an M of food delivery programs under the Older Americans Act. You may know that as Meals on Wheels, and then provided free COVID testing for the uninsured through Medicaid. Now, there's a lot of things we didn't get done in there. We didn't get full waivers on copays and out-of-pocket expenses for COVID-related treatments and vaccines. We are pushing to get that in the next package. We also need to provide significantly more support for the U.S. Postal Service, which has a really important role for all of us, but certainly for seniors of trying to get mail through, especially when communication is a little bit more difficult. So there's a lot that we are still working on in subsequent bills, and I'd be happy to answer your questions about details of those bills or what we're working on going forward when we get to the question period. Thank you for the time.
Yeah, thank you so very much. So for those of you who just joined us, my name is Courtney Hederman, and I'm with AARP Illinois. And if you'd like to ask a question of Congressman Sean Casten or Dr. Kate Rowland, you can press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. So again, press *3 on your telephone keypad. So in addition to Congressman Casten tonight, I made reference, we have Dr. Kate Rowland. She's a family physician at Rush Copley Medical Center in Aurora. And Dr. Rowland is also a board member of the Illinois Academy of Family Physicians. So good evening, Dr. Rowland. Thank you so much for being with us tonight. You're on the front lives and saving lives, and thank you for everything you're doing.
Thanks. I'm very glad to be with you tonight. As Congressman Casten said, this is a public health crisis, and I think everybody has their own unique personal risk depending on their health problems and what they have in their personal lives, but this is also very much everybody looking out for each other. And so a lot of the things that we've been asked to do recently, all of this being isolated and staying at home, all of that has to do with trying to keep the public health risk at a level where our medical system is able to deal with it. And so I wanted to say thank you right up front to everybody who is staying home, because it genuinely is saving lives. And what we see in the hospital, I have
Dr. Rowland, are you there?
We take care of our own. Hear me?
Oh, nope, yeah, we can hear you now. Go ahead.
Okay. Could you hear me at all?
You
Are you
had
able to hear me
off.
now?
Yeah, I can hear you now, but you faded off at one point.
So sorry. I was hoping to say thank you to everybody who is helping us manage this public health crisis by staying home, because being able to take care of our patients and not being overwhelmed by a huge influx of very sick people has made a big difference to us. We aren't seeing the things that are sometimes happening in other parts of the country and other parts of the world. So we know that healthy individuals make healthy communities, but healthy communities also make healthy individuals. And that's the biggest thing that can sometimes be hard to understand, but we're really seeing it happen right now. So that's my introduction. Thank you.
Thank you.
Thank you so much. Thank you both for being here this evening. And to remind folks, I'm Courtney Hederman from AARP, and you're listening to AARP's discussion with Illinois Congressman Sean Casten and Dr. Kate Rowland on the coronavirus. If you have a question for either one of our guests, Please press star 3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. So again, please press star 3. So let's get to some questions. Right now, it's my pleasure to introduce AARP State Director Bob Gallo. He will now be opening the line to our callers for their live questions. So good evening, Bob.
Good evening, Courtney, and thank you, thank you, Congressman Casten and Dr. Rowland. And we also are taking questions from Facebook Live. So let me start with, and I'll ask a question for Lorraine. Lorraine says, I want to get tested without going to the ER room. However, I do not have all the symptoms. Where specifically in Dupage can I get tested? If either of you two would like to answer that, please go ahead.
I can field that one. So testing is a huge issue that we're having right now, and there's complicated reasons why. I don't have a short answer, a short and easy answer for your question. You should start by seeing your own doctor, and by seeing, I mean potentially calling first, asking everybody, and again, this goes back to the public health recommendations that we have, asking everybody to call their doctor first or your healthcare provider before coming in, especially if you have any symptoms. If you're feeling unwell in any way. And the reason for that is just like we're asking everybody to stay at home, if you are sick, there's a good chance that we will not want you to come in, that we'll be able to do some screening questions over the phone first, and we may be able to refer you for testing. What I will say is testing, again, has been an issue. We don't have enough tests, and the reasons for this are complicated, but this is a brand new disease. Right? We didn't, 3 or 4 months ago, there was no human being on the planet who had this disease. The first cases came out in December of 2019, anywhere ever. So this isn't, it takes more than a couple of months for us to develop tests, for that technology to be there, and then for us to have enough for production to gear up. And we want to make sure that those tests are very accurate before we roll them out on a big scale. So that's why you may not be able to come in like you can, like you can get a test for a urinary tract infection, or you can get a test for anemia. Those are very old diseases. Some of them going back to antiquity even. So it's going to take a little bit of time before we can ramp up testing so that every patient who has symptoms is going to be able to get tested for it. But to answer the very specific, if you have any symptoms that you're at all worried about, almost every healthcare system has systems in place where if you call them and you say, I have a fever, I have a cough, I have a sore throat, I've lost my sense of smell, I have bad fatigue, any of those symptoms, even if you just have questions, just give them a call and they will walk you through what should happen next. That is going to, again, depend on you as an individual in addition to your symptoms.
The one that I did totally echo everything Dr. Rowland said. The one thing that I would just emphasize, and to go with Dr. Rowland's initial thanking people for doing their part to keep us all healthy. I want to also thank everybody for deferring to the wisdom of public health experts on this. We don't have enough tests. We are doing everything we can to get more tests. The point when we can have a conversation about opening up parts of the economy is going to have to be informed by a much larger set of tests that we have. But in the meantime, that means that public health officials are having to make decisions about how to apportion scarce resources. And that has necessarily meant biasing tests in favor of people who are symptomatic and or are frontline healthcare workers who we want to make sure stay safe. And so if you ask for a test and you're told that you can't get one, just please be respectful and be civil to the person who gave you that answer, because that person no doubt wishes they had more tests as well, but's trying to juggle a lot of balls. And everybody, I think, is at a moment right now where they have more responsibilities than resources, but we are all in this together.
Yep, indeed. Very thoughtful. Let's go to the live callers, and we have Matthew. Good evening.
Yes.
Good evening, Matthew.
Thank you. I'm very concerned not just for the health professionals getting all of their supplies, which are in such shortage, not just in this country, but around the world. But I don't see anybody pointing out the fact that we as consumers for just our regular medications are also being buffeted around by this global supply chain fiasco. I know we haven't endeared ourselves to a lot of the countries around the world, and now it's kind of biting us in the butt, as it were. But I myself, for example, have spent about the last 3 weeks almost every day just trying to get one of my wife's brand name medications. And I wonder, just as consumers, not just as the health professionals, if people are realizing how catastrophic this can be for people just trying to get their regular medications.
Great. Hang on, we'll get an answer to that.
So this is Sean Casten. It's certainly, I think one of the lessons we're all taking out of this crisis is that it is magnifying all of the challenges we had in our economy before this moment. It's magnifying in terms of the people we are depending on. In many cases, are not the most well-paid people who are working in very bottlenecked worlds. And as we've moved to a very rapid just-in-time delivery system, that also means that it takes only a very small hiccup in some of those systems to really be disruptive in the system. So what you're talking about on supply chain, we've got issues we're trying to go through in our food supply where, if somebody gets sick in a meat processing facility, they have to shut that down. And how does that, do we all of a sudden undo that whole value chain? I would not agree with your point that we are having sort of, diplomatic challenges, that people who think we weren't treated them well are somehow withholding favors from us. I've certainly not held anything to that extent, but we are in a globalized world where supply chains are global for a whole lot of materials, and we're working hard to try to get through this. But it's a real concern. I would emphasize for everybody that as recently as 2 hours ago, I was on the phone with Colin Peterson, who's the head of the Agriculture Committee, who was stressing that there is nothing in the food supply system, which is a little bit different than what you're talking about, but there's nothing that would justify hoarding behavior. The system is robust, producers are there, but the tendency that people have to hoard is creating these essentially pulses of demand in a system that wasn't designed to handle that level of fluctuation of demand. So again, and maybe this will be my answer to all the questions, we're all in this together, and to the extent that we can individually try not to sort of panic buy things, it takes a lot of this pressure out of the system that is somewhat brittle right now.
Very helpful response. Thank you. How about Earl? Ask you a question, please. Hello, Earl.
Yes, I'm sorry, and I appreciate this forum. Most of us try to stay informed the best we can, and yet I'm concerned about the inconsistent messaging going on. We've seen evidence that the stay-at-home is working, and my neighbors and I are practicing that here in Lake in the Hills. But we hear the mayor of Chicago wanting to extend it one time, the governor wanting to extend it, the stay-at-home, and yet at the presidential level, we hear somewhat a different message, and that is that the focus should be on getting us back together again. I understand the economy, but I don't understand why we can't come up with a consistent message about stay at home. Thank you.
Okay. Congressman?
Well, I realize you guys are nonpartisan, but I really want to stress that in this moment, we need to listen to public health experts, and there is a real danger. If your mechanic was giving you health advice, you'd be nervous about what your mechanic's motives were. And if a politician with no public health experience is giving you public health advice, you should be nervous about what their motives are. What we know absolutely without question right now is that we do not have enough tests. And what we also know absolutely without question is that not just those states in the United States, but those countries that moved aggressively early on to enforce stay-at-home provisions have bent the curve of new cases much more quickly. The reason I mention both of those in tandem is that the countries that have done wide-scale early testing, South Korea being really the showpiece, and widespread early stay-at-home, bent the curve down to the point where they are on the verge of being able to safely reopen their economy because they know where the pockets of disease still are, they have good data, and they isolated. In the United States, we have states that have seen a slowing in the rate of new cases, and Illinois is doing pretty well on that. I think Washington State is head of the class, but we still don't have anywhere near enough testing to know with confidence that if we all went out tomorrow, we wouldn't be running into people who are asymptomatic but still transmitting the disease because we haven't had the resources to test them. So if anybody, elected official or otherwise, was to tell people to go out now without testing, you're potentially going to cause people to get infected and sick and die. And it's just irresponsible to say that in the absence of having more data. We will start to get that data, and we'll start to go from there. There are good proposals out from public health experts about what sorts of statistics we should be looking for to collect before we open up the economy. But we don't have that. We don't have the data to make that judgment right now. And it's irresponsible for anybody to suggest otherwise. And I would, with that in mind, I would defer to Dr. Rowland as the legit public health expert on the phone if anything that I said is incorrect.
No, I agree 100%. One of the things that we worry about and that they've seen in other parts of the world is exactly that even if when we have good tests is absolutely going to factor into, when we think it's safe for people to go back out and to go back to work, to go back to school. But other parts of the world have seen some uptick in cases when the doors are reopened, so to speak. We just want that to be in a manageable fashion. We want as few people to get sick as possible, and that's we're more or less waiting for those markers to come down from the sort of bosses of public health, and we're ready for them. When we know the tests are accurate, when they're able to produce them in enough numbers that we're able to use them on enough patients for it to be safe.
Okay, gotcha on that. So, folks, if you have just joined us, my name is Bob Gallo, and I am the State Director for AARP Illinois, and you are listening to a teletown hall with Illinois Congressman Casten and Dr. Kate Rowland, and we are also taking questions live. So to ask a question at any time, please press *3, and you'll be connected to one of our AARP staff people who will put you into the queue to ask your question on air. And so with that, we'll continue taking calls from our listeners. And we have Tom who has a question. Tom, you're on the air. Thank you. Hello, Tom.
Yes, good. Yes, I'm here. Good evening. Thank you for taking my call. I've been listening to the response just made to, I believe it was your first call-in question about the availability of testing. I'm a senior here living in St. Charles, Kane County, and I understand that the testing facilities are not there, that the resources are not there for either antibody testing or even for testing for people presenting certain symptoms. Well, my question for you, Congressman, and my question for you, Doctor, is when are we talking about here? Are we talking about an improvement in availability in a week, a month, a year, ever? And the reason I really ask that is because I see that the target number for testing in Illinois may be as low as 10,000 a day. And if that's the case, it's going to take us forever to catch up. So I wonder if you have an answer as to when. Thank you.
Dr. Rowland, you want to at least maybe reiterate what you said? But it seemed like there's also a question about testing to antibodies, which would help us understand when we could go back outside again.
Right. Well, the antibody testing will help us know if you've had the disease, which we think conveys at least a temporary and possibly a long-term immunity. And that would help us know, for example, if you personally are immune, which means that you personally, as an individual, would be at lower risk. So we're starting to see some antibody tests being developed. Again, the question is, how good are they? All tests have a certain false negative and false positive rate. We're still, again, these are new tests, so we need to know what are those rates. Some individuals have a certain false negative and false positive rate. So those
Dr. Rowland, we've lost you, I think. Okay.
Well, let me hop in.
Let's start using it.
Oh.
Any better?
Go ahead, Dr. Rowland.
I'm not sure.
We hear you again.
I think we can hear you now.
Okay, I'm not doing anything differently other than talking very animatedly. But so each test has to be good enough to be used on 7 million people in a state in order for the public health officials of the state to say, yes, we can use that and we can know that it's good enough. We're also getting point of care tests, for example, that we can use in just a matter of a few hours or minutes instead of several days, which is how long the current tests that we have are taking. So we're definitely seeing progress. I don't have an answer for exactly how long is it going to be before we have enough tests for everybody who has symptoms, or for at least a majority of people who have symptoms. Unfortunately, I don't have access to that information.
So I would add just a couple things. Is that number one, as Dr. Rowland pointed out, there has been a significant improvement in the testing volume. We were doing measured in the thousands a day, and are now doing in the hundreds of thousands a day nationwide. We have also, particularly with some of the developments of the new Abbott technology that you've heard about, the rate of time it takes to get results has come way, way down. So that some of the early tests was taking, 1 to 2 weeks, sometimes even longer, to get results back, by which time, you've gone from asymptomatic to symptomatic to, more serious conditions if you're not careful. So those are improving. What has been a bit of a concern for all of us in the legislature is that over the past week, the number of tests has been coming down a bit. And in part that was some decisions made by the White House, I believe, not to reimburse the states for their testing at the rate they were before. And so we're seeing fairly consistently something like 20% of the people who are tested are testing positive, but a smaller number that are getting tested over the course of the last week, which means that we are almost certainly understating the total number of cases. We really want to get that number of people who are testing positive down to the low single-digit level to feel comfortable that we can reopen. But we also want to get to a point where we have enough tests to be doing testing on a statistically broad sample of the population, which probably means something like 5 to 6 times or more the testing volume we have right now, and that's when we'll know we have enough testing. There's a fairly significant difference in some of the things that you see in the data. Again, I'm going to give the South Korean example. When you look at the South Korean data, they look like a total anomaly, that in most countries it shows that the majority of the people who are getting infected are the older population. And in South Korea, it looks like the majority of people getting infected are younger. That really reflects the fact that South Korea took a conscious public policy decision to do statistically broad sampling of the entire population, whereas the rest of us have been sampling people who are symptomatic, and people who are older are more likely to become symptomatic. Well, that raises really, because of that data lag, it means that in South Korea with statistical testing, they've got a better sense of, what communities by geography, what communities by demography seem to have developed some level of herd immunity that we can start to open it up. We just don't have that data here. So my answer to the question of when is, I don't know when, but as soon as possible. But the goal is to have 5, 6 times the volume of testing, and at a point where we have sufficient testing that we can be doing testing of the entire community and not just people who are symptomatic.
Okay. So let's go back to our live callers, and we have Carolyn on the line. Carolyn? Hello, Carolyn?
Yeah.
Would you like to ask your question, please?
Would I like to ask another question?
If you'd like to ask your question to the congressman directly and Dr. Rowland.
Well, I don't have any symptoms, regarding the coronavirus.
Okay. Did you have a question about the stimulus check?
Yeah, you said it was, you're not on Social Security and you have the 1099, that means you still get that, correct?
Yes, that is correct. I want to clarify. So the checks were set to go out so that anybody who earns $75,000 or less per year will get a one-time check of $1,200. Children will get $500, and then for every $1,000 you have above that threshold, it falls by $50, and so at $99,000 you're not getting a stimulus check. So not everybody will get a check, depends on what your personal situation is. But we did make sure that those checks go out not just to people who are have filed tax returns, but also people who have 1099 benefit statements. If the Treasury Department started releasing checks this week to people who have direct deposit on file with the Treasury. If you have that through your 1099 or otherwise, you will start to see those checks coming through this week. I think they said they're going to try to get about $60 billion out this week. They are then going to, I think starting 2 weeks from now, start releasing, I may have the 2 weeks wrong off the top of my head, but start sending, I think the goal is 5 million checks a week, starting with people at the lowest adjusted gross income and then gradually working up with the idea that the money will go first to the people who need it most. So it's a long-winded answer, yes, to your question, but if you have, income from other sources that takes you above that $75,000 to $99,000 level, you will get either less than $1,200 or nothing at all if you're at the high end of the wealth scale.
Okay, thank you. Let's go to Venka in Oak Brook. Venka, can you ask your question, please?
Hello.
Hello.
Hi,
Please ask
this
your
is
question.
for Dr. Roland. This is for Dr. Roland. I want to know if someone is asymptomatic, how long does it take for that person become symptomatic?
Yeah, that's a good question. So if the short answer is we're not completely sure, but 5 to 7 days is our best guess. However, if you have been exposed to somebody who you later find out was diagnosed with the COVID-19 infection, with or coronavirus infection, then we recommend that you stay in isolation for 14 days. So if you happen to know that you were on at a party with somebody, if somebody came to your house and then they call you in 3 days later and they say, oh my gosh, I've gotten sick and I've been diagnosed, then we recommend that you stay in isolation for 14 days because that's the longest period of time that we would expect symptoms. But generally, people tend to get sick a little bit sooner, so 5 to 7 days. So if you have any kind of exposure that you're worried about, you stay in isolation for 14.
Okay. Folks, this is Bob Gallo with AARP Illinois. We're on the line with Congressman Casten and Dr. Roland. And if you have a question that you would like to ask either one of them, press *3 on your telephone keypad, and we'll put you in the queue and see if we can get to your question. So we do have some more questions here, and we have one from Dee.
Hi, thank you for the opportunity. I just have a quick question. Is it true what we're hearing that after this is all done, we are going to have to carry cards that show our all the shot records that we've had?
I'm not aware of that. Dr. Roland, are you aware of anybody who's saying that?
No, I haven't heard that either.
Mm-hmm.
Okay. I guess our question was she was feeling as though if folks do eventually get a vaccination, are they going to be asked to carry some type of proof of that? But we've not heard that at all. There's been absolutely no discussion of any of this. There are interesting questions that I think lots of ethicists, not legislators, those of us who have an interest in ethics are thinking through. But once we get to the point of having serological testing of whether you have been exposed to COVID and have antibodies in your system, as we start to reopen the economy, how do we do that in a way that's equitable? And that's not about carrying cards, but as you might imagine, there's a lot of ethical questions that arise of if the scope of people who are infected may or may not overlap perfectly well with the range of people who really, for economic reasons, need to get back to work. And that's a tricky question that ethicists are talking about, and maybe that's the context of what you heard, but that's no one is remotely suggesting that we should legislate that people must carry cards or,
provide confidential health information. But there are going to be questions we have to think through ethically about how to reopen the economy once this is done prior to having a vaccine available.
Okay. Thank you. Question from Elizabeth.
Yes, this is Elizabeth from Dupage County, and I would like to know if the SNAP program will be expanded for seniors. Right now, I get $15 a month, which doesn't buy very much.
Thank you for the question. We did not get it. We had significantly bigger expansions of the SNAP program in the House version of the CARES Act. We were not able to get all that we wanted in the Senate version, but that's the nature of compromise, and we will keep pushing it. We did significantly expand food aid of all varieties, including SNAP early on. We did significantly expand the Meals on Wheels program, and it's not lost on any of us that what we did, while massively significant relative to what we were spending on food assistance before, is not nearly sufficient relative to the need that's in the country right now. I was speaking to a food pantry earlier today who said that they historically have had about 1,000 customers a week, and they're now seeing 300 to 400 a day. And so we need to be ramping up much quicker, and we will be pushing for that for larger expansions in the next packages. Thank you for the question.
Okay, thank you for the answer. Matt has an international question. Matt?
Yes. Over the past 2 decades, multiple viruses have sprung from the same reason and source, the wet markets in China. And even though the Chinese and Americans were recently working together to research possible 106 different pathogenic viruses similar to this corona, all of that research has been stopped. And they're also in China thinking of reopening these wet markets again. And I'm just wondering how on earth, we can apply some sort of diplomatic influence to stop this.
So for me personally, worth pointing out that I've actually just sent a letter to the World Health Organization last week, expressly asking them to start clamping down on the trade in endangered species in these wet markets, and was on the phone, had a phone call earlier, the end of last week, with the Chinese consulate on exactly this subject. So we are doing everything we can to pressure on that. I do want to emphasize, and maybe Dr. Rowland can speak on this more eloquently than I can. The issue we have with the virus is not where it originated from, but its mode of transmissibility. It does happen that this virus, leapt from animals into humans, and that the wet markets were a conduit for that. But the fact that the virus evolved to have this sort of peculiarly challenging rate of infection, where most people stay asymptomatic, but a significant proportion of people become seriously ill or die as a result of this, those conditions of the virus could have evolved from a lot of different channels, including but not limited to coming through wet markets. So even if we were to totally clamp down on the wet markets, that doesn't change our exposure to global pandemics. And I'll leave to Dr. Rowland to comment if I've got that wrong, or if there are other areas you think we should also be focusing on.
No, I think that's just right. I just wrote a paper today calling into question whether the transmission had originated in the wet market, because of the very earliest cases that they were able to trace. It was something like, don't quote me on the numbers, but only 2 of the 7 had any contacts with the wet markets in Wuhan. So, there's a lot, as I've said, that we don't know about this virus. This is, I don't know how much virology we really want to get into, but this is how viruses mutate, how they transform, and how they're able to get from the kind of coronavirus that we get all the time, something that our bodies are used to a novel coronavirus, something that nobody has any immunity to, that we need to, that our bodies have to gain immunity to, that we have to get this. So this is how they mutate. They go from a human to an animal vector, and then they come back. And a lot of them go from humans to animal vectors and never come back. They don't cause us any more trouble. So the idea that if we say, okay, no more wet markets, we're able to influence that in some way, there would be some other vector for causing other kinds of infections. And a pandemic can be caused by anything, where there's some kind of immunity or some kind of infection that we don't have global immunity to. So there obviously are a lot of public health things we could do. Obviously, public health is a complicated concept, and we sort of bring our influence to bear in lots of different ways. But there are things that we can and can't influence to more and less extent. And viruses are viruses, and we probably can't have a lot of diplomatic influence on the virus itself.
One last point. If I could make one last point on there, just because I think I think we need to be careful about laying all the blame on a particular cultural practice in a country that we don't live in. Swine flu came from pigs, and we're going to have pigs regardless of whether we have exotic animals in wet markets. Avian bird flu came from birds and was transmitted. I believe crows were a vector there, and we're not going to shut that down. So the issue, as Dr. Rowland said, is these viruses that can hop from animals to humans and back and forth. But you don't shut that down just by shutting down a particular cultural practice that we're not familiar with until all of us are going to stop living in close proximity with animals, which seems unlikely.
Right.
Interesting. Okay, speaking of the animal to human, Marianne has a question. Marianne?
Hello?
Hi. Ask your question, please.
Oh, yes. My question was, and I have a sore throat, so I was wondering if someone else could do it, so I'll just make it brief. But when you're taking your pets out and you're keeping your social distance, the pets interact. I mean, sometimes you can't control that. So then I heard lately that pets can get this virus. So how does it work if you bring your pet home and he's jumping all over you or whatever? I mean, if the pet got it from the other one, I'm not clear on how this works. Are you supposed to give your dog or kitten a bath every day or what?
Okay, hang on and listen.
Yes, pets should be washing their paws. So the pets are another area that we'll know more about probably in a few months than we know right now. There is some evidence that animals can get coronavirus. They probably don't get it as nearly as much as humans do. They don't get as sick from it either. So we don't know whether a dog can get it from another dog. The few cases that we have seen in animals, it seems pretty clear that it was a human to animal transmission. So I don't know if nobody knows if dogs can get it from another dog by interacting with each other, or if, a household, dog can get it from a household cat, for example. We also, if a dog is going to get it from another dog, they would be most likely to get it the same way that humans get it from other humans, which is by respiratory droplet spread, which is, more or less from talking, sneezing, coughing in the same vicinity as another animal. So it may not be bad advice, I guess, to have your pets wash their paws the same as, you or I would wash our hands. But the exposure has probably already happened by the time your pets interact with each other, or your pet interacts with somebody else's pet. The good news is, again, that this seems to be a very small risk of infection. And what we don't know at all is whether, and it does not seem to be very common if it happens at all, is for the dog to be able to infect you if the dog happens to get infected. And, we're talking just a very small handful of cases around the world. There was the very interesting case of the tiger getting infected from its human zookeeper in New York, but again, very rare.
Congressman, you're a dog owner.
Keep 6 feet away from tigers.
I am not going to get out of my lane on this one. I'm going to listen to the doctor on that one.
Okay. Well,
stay 6 feet away from tigers is standard medical advice.
With bars in between. Thank you.
Yeah.
So let's go to one more caller here, and this is the Marilyn. Marilyn, you're on the line. You have a question?
Not me.
Hi, Marilyn.
I've already asked. Hello?
Oh, well, yeah.
Hi.
Go ahead. Ask your question again, please.
Yeah. Oh, you want me to repeat? It's just that I was wondering, we hear from everybody that we should have the N95 mask for protection, and yet trying to find them is almost most impossible at this point, even though I understand that. Hello? Hello?
Yep, we hear you.
Even though I understand that first responders, firemen, etc., are entitled to have them naturally before we would get them, but where are we going to be able to get them if we're supposed to have them to use on a daily basis?
Okay, hang on. We'll get you an answer.
So I would say this is much like the testing. We do not have as much protective equipment as we would like to, as we should. We are putting every resource we can from Congress and pushing the president to put every resource that he has available to him as well to ramp up the production and supply of masks, gowns, visors, face shields, and on the back end, the treatment facilities and ventilators and what have you. We're still short. And that means that we are unfortunately having to triage and prioritize distribution to folks who are in the most need, and particularly to our frontline healthcare workers. That doesn't mean you can't wear a mask, and I would defer to Dr. Rowland on this. But in general, the N95 is protection for someone who is regularly in contact with sick people. Something where you think you might be sick and don't want to get someone else sick is a much lower tech mask, and my daughter has been stitching those today so that when we go to Target and go grocery shopping, we can wear something on the chance that even though we're asymptomatic but wonder are we possibly going to share this, we can use something lower tech. So I wouldn't fear if you're not symptomatic that you don't have a full-on N95 mask, but I wouldn't anticipate we're going to have as many as we wish we did soon. And again, I would turn over to Dr. Rowland to correct where I may have misspoken here.
No, I think that's just right. So the N95s, if you happen to have them, we ask that you please send them to those firefighters, send them to the hospitals, because those are the ones that will help protect people who are around people who are known to have the infection. If I'm going to be in that patient's room for 10 or 15 minutes or more, or a nurse who's in that room for 8 or 12 hours, those are the people who need those N95 masks. If I'm just in the hospital and seeing a patient who isn't known to have the COVID infection, I just use a regular surgical mask, which provides enough protection against the virus if I'm not going to be in a room with a patient, again, who's known to have the infection. So I don't use N95 masks unless I have at least a certain level of risk either. Again, when you're out and about, when I'm out and about, a cloth mask of any kind is fine. The main point of that, like the CDC says, like Congressman Casten says, is mainly to protect other people from you. And when you see other people, just in case you happen to have gotten it from somebody else the last time you were out in the stores, and if there's any chance that you could be spreading the infection without symptoms. So every time you see somebody else wearing a mask, you can silently thank them for choosing to protect you. So that's the point of the cloth masks. You can find the newspaper will tell you how to make one without sewing. There are plenty of, if you have access to the internet will tell you how to make a mask either with or without simple sewing. So right now the CDC is recommending them a simple cloth mask if you're going to be out of the house, again, to reduce the risk not only to you but to people around you.
Great. Thank you, Dr. Rowland. And folks, this has been an informative discussion, and I'm sorry to say we're near the end of the time of our call. But Congressman Casten, do you have any final comments before we close?
Only to close with the nice, inspiring remarks that Dr. Rowland made at the start of this. We're all in this together. This is a collective problem. We are all going to get out of this together. I think all of us are keenly aware of how many folks are sacrificing and how many folks, particularly our frontline workers in the healthcare industry, folks who are making sure that our grocery stores are still stocked. People are making exceptional sacrifices. So thank you to all who are making sacrifices of any kind. Be civil, be respectful to each other, be decent, and we will get through this together. And hopefully we'll come out of this with a little bit more joint respect for each other, for civility, for decency, for science, and minimize the chance of something like this happening again. But thank you to everybody.
Thank you, Congressman Casten and Dr. Kate Rowland. And thank you, AARP members, volunteers, and listeners for participating in this discussion. We apologize if we were not able to get your question. If your question was not addressed, please go to www.aarp.org/coronavirus. For the most recent and up-to-date information, you can call the Illinois Department of Public Health at 1-800-889-3931 or visit www.coronavirus.illinois.gov. You can also stay on the line at the end of the call and leave a question or comment, as well as your contact information. AARP will follow up with you afterwards. We hope you learned something new about the coronavirus and keeping you and your loved ones informed and healthy. Thank you and have a good evening. Be well. This concludes our call.